organisations. So we're delighted to come and talk to you today a little bit around going through some of the different types of digital health technologies, or apps as they're known, that are available and how they're being used, and how to identify the good ones as opposed to the not so good ones. If we can pop on to the next slide, please, Carly, that'd be great. I thought that I would just be clear on the definition. When we're talking about digital, we're not just talking about a technology platform. The definition that we've adopted as a board across the system is making sure that we are applying the culture and the processes and the business models that those technologies are there to help, and responding to the current day expectations of our population. So we definitely want to be clear that we look at apps and we look at the value of those apps and the place that they play in our care models, and we make sure that that is the mechanism that we're using to cause the change that we are looking for. So why are we focusing on digital health as such? So the biggest threat to healthcare is our workforce. The careers in health haven't been a #1 choice for many people for a long time, and it's becoming increasingly more important, even more so with the situation with COVID-19, that people are educated in how to manage their health conditions in a supported way, and that can be done on a few different levels, and I'll go through the health levels in a moment. But we're really looking at an elastic band, and an invisible elastic band that sits around the patient and their care team. The Android and the app stores are awash with digital health technologies. There are hundreds of thousands of them out there. In fact, I think the last count, there was in excess of 360,000 apps. But how do we know the difference between the good ones and the dangerous ones? And not all of them are the same. The slide that you're looking at now shows that there are different levels. Level 0 and level 1 apps are really standalone digital health technologies. They're not connected to our care models, so there's no need for a digital interface or interoperability. They could be wellbeing apps like diet and exercise. 2s and level 3 digital health can often be known as personal health records. So they're usually condition agnostic. They're used around sending clinical correspondence, appointment booking, prescription management, and they usually need full integration or interoperability with the clinical systems that we use in both our GP surgeries and our acute hospitals and our community sector. Level 4 digital health technologies are very much around pathway replacement. They are usually an app or a wearable with an accompanying app. With a lot of these are medical devices. They're diagnostics or they're screening tools with a form of machine learning like heart monitoring or mole checkers. And they require a lot of regulation and an awful lot of evidence to support that they are clinically effective. So those are the different types of technologies that we're looking at when Carly and I are working with clinical teams. It's really important that in order to be able to achieve the vision that we're looking at as a system, that we're looking at technologies that help ease demand and keep people supported in a virtual way. And so in order for us to fully understand the challenges that we were going to face, we actually did a pilot along with our primary care teams, their nursing teams. They were all given pre-populated tablets with digital health technologies that were approved by NHS Digital and Health Education England. And the teams were asked to use these in their daily contact with patients. Now, we weren't looking at evaluating the impact of the technology itself, but more about how it changed the practice and the working behaviours of the teams using them. And the feedback was really insightful. The clinical teams gave feedback to say that they were really relieved to know that they had a single point where they could go and make a recommendation, because they didn't know where to look in the first instance. They were glad that they had technologies that were already approved and was already reviewed, as they wouldn't know how to do that. And they were grateful that they had a team that they could ask their questions, especially when it came to what they recovered under their indemnity. So these were some of the 4 main challenges that we had to deal with. It was around awareness, making sure that it was accessible, that we were helping to build trust, and that there was some type of a central coordination around the technology that we were looking to use. We wanted to break down these barriers in the use of digital health tech in the first instance, because we were serious in making sure that the workforce and the population had the technologies that they needed. But we had to do this in a building block style. So Carly, if you wanted to go into the next one. So these are our building blocks to digital health technologies. They are all designed to dovetail each other, and they build off of the capability or the behaviours and the knowledge of the previous. Couldn't give a pre-populated tablet to every clinician. We needed more of these technologies, and we needed to make sure that they were constantly being evaluated because they're constantly being updated. We needed to protect the chain of indemnity or implied liability for our workforce teams because it was a genuine concern of theirs. And so we were looking for a partner who could evaluate the care technologies in three main areas. So under clinical assurance, data protection and user experience. We wanted to make sure that that evaluation was continued every time a technology was updated so that we could mitigate that chain of indemnity. And we wanted all of these technologies to be visible in one space, both for the workforce and for the public. And we wanted to make sure that it was easy to understand. We wanted that platform to act as a horizon scanning tool for transformation projects as opposed to research projects. So we wanted to make sure that there was a clear understanding of what a regulatory sign-off looked like. Dorset has plans for a living lab and a community place-based centres for innovation and research, and we're working in conjunction with those. But we really were looking for a partner in bridging the gap and the knowledge around regulation. And that's why we've partnered with a company called Orca for our digital health technology app library. And I'm going to pass over to Carly, who's going to talk a little bit more about this.
Thank you, Crystal. So apps present a fantastic opportunity to provide us with valuable health information, which can help us not only improve the quality of our healthcare, but also help us to live healthier lives. Dorset CCG have partnered up with Orca, the Organisation for the Review of Care and Health Applications, to provide this site for you all to solve just those problems. The apps you'll find here have had independent and impartial reviews, and you'll see that the resultant information is clearly presented throughout. We can be reassured that any apps shown on this site have undergone a rigorous review process and can feel confident as we choose the best app for us. By bringing this information to our fingertips, it's now possible to identify and compare the best apps for our needs, and to ensure that we and our friends and families can get access to quality assured apps. Whilst this platform's not promoting or recommending any particular apps through this process, it is providing impartial information about an app's compliance with standards and a mechanism for end users to easily identify those apps that best meet those standards and to check those which don't. So what is it? Well, it's a safe place to play where clinicians and users have the confidence, sorry, frog in my throat, have the confidence to explore and utilise digital health technologies, supporting them to improve their overall health and well-being using the wide range of apps available safely. And who's it for? Technology is fast becoming integral to our daily lives. There's truly an app out there for everyone and everything. Just through the pandemic, app usage has increased by 37%. And whilst this is fantastic, it's also concerning as over 80% of health apps do not meet regulatory requirements. The vast amount of apps out there make it difficult to know what apps are safe and do what's advertised. Therefore, this website is available to and accessible by everyone. Why do we need it? It's not just a web platform, it's an evaluation service that goes with it. So if there's an app that's in use but hasn't been reviewed, we can request an assessment and understand if it meets our needs. There are approximately 367,000 health apps on the market, as Crystal said. Around 5 million apps are downloaded every day, and this library just helps to drown out the noise. So how's it going to benefit? Ultimately, Orca power our library due to the service provision that they provide in helping us to break down the barriers around digital health. Having scoped why the clinical teams do not freely recommend digital health technologies as part of their advice showed us that the barriers were, firstly, they had no idea where to look. Secondly, they queried if they were allowed to recommend due to implied liability. And thirdly, if the digital health technology was of a good standard. Partnering with Orca mitigated all these issues and is helping to build trust with clinical teams by the use and education or awareness that they receive either through the use of the library and its app cards, the onboarding sessions from our teams, and the community of practice emerging. It also saves a great deal of time in horizon scanning as part of the standard toolbox for any service to use. We're growing the knowledge that if there's a technology, app or wearable with split level app associated that we want to recommend and it isn't in the library, to hold off until Orca have evaluated. No research apps are within the library, which also helps the transfer plans. You can access the library via the URL on screen, rdorset.nhs.uk/apps. So there are two different types of way to use the site. The first requires no sign-in and simply allows you to access the library, browse and download apps. This access we refer to as member access, and it would be the type of experience that a member of the public. The second is professional access, often referred to as a pro license. For this access, you'd need to attend an onboarding session. You'd then be provided with a code to set up your account. A pro user benefits from access to their own My Orca dashboard. This enables the ability to recommend apps to others with just their email address or mobile number, favourite those apps which are regularly used or recommended, and see what has been downloaded following those recommendations that have been made. It also allows us as a system to understand what the needs of our community are in terms of what is being searched for or downloaded and what trends can be identified from that information so we can better tailor our services going forward. Searching the library allows you to apply filters to ensure the apps you're searching for meet your needs or those of your service users. You can filter the costs of apps, the platform they operate on, who they're suitable for, even down to the country they were developed in. The app cards provide you with an at-a-glance look at the app you're considering, showing key information along with its all-important review score. The review process starts with a weekly analysis of all the apps available on the App Store or Google Play in the health, wellbeing, and medical sections. Orca then filter out apps that are not designed for use in a supported language and apps that have not been updated for 18 months or more. The remaining apps are then organised into over 350 health and care condition categories and queued within their category by most downloaded. There are a huge array of different types of health and care apps available with an equally wide array of functionality and sophistication. And just because an app offers more functionality, it doesn't mean it's automatically better than a functionally simple app. Apps that, for example, simply provide information and guidance, similar to health leaflets, can be very useful in certain circumstances, and this isn't impacted by their relative functional simplicity. This is where the scoring that Crystal explained earlier is important, and the levels of apps are demonstrated on the card. As well as categorising the apps, they are then scored against three distinct areas or domains. Data privacy looks at what information an app collects from you, what it does with that information, and how secure is its handling of that data. For some apps, this is only a minor issue as they don't gather much information. Other apps can gather lots of very personal and sensitive information, and for these, it's important to know how they go about handling this. Clinical assurance looks at what evidence there is that there is a suitably qualified professional or organisation behind the app, or that it's been endorsed, accredited, or underwritten by such an individual or organisation. It also assesses what evidence there is around user testing and the effectiveness of the app in terms of claimed health benefits. The higher the level of the app and the more sophisticated its functions, the more crucial this becomes. User experience looks at how an app has been designed to support the overall user experience. This includes its availability on both primary platforms, how customizable the app is, how well it caters for end users with different capabilities and needs, such as visual or other impairments, how content is managed, how well supported the app is, and what it costs. This area also looks at overall user review scores from both platforms. This analysis results in an overall Orca score, which is built up from the answers to each of the questions in the three review domains. Some questions earn positive points and some earn negative points. The Orca score aims to deliver a meritocratic evaluation with all apps being treated equally and fairly, irrespective of their current popularity or the financial position of their developers. Any score below 65 would indicate that an app has some issues that users should investigate further prior to using this app. And scores below 45% indicate that an app has considerable issues or challenges and in its current form is potentially unhelpful or unsafe. For more information about the review process, please do visit the website and take a look at the About section or the FAQs. So what next? In order to ensure that everyone's benefiting from this valuable tool, we need to make sure everyone knows it's out there. One of the biggest barriers to adopting digital health technology is not knowing what's available, and this platform helps to solve that problem. In order for it to be of use, we need to socialise it, and that's where you come in. Having a link on your organisation's website will help to signpost to the support available. We run regular onboarding sessions as well as focus webinars to help get the most out of the app library and help you to understand more about it. We have a dedicated community of practice set up to support with the digital technologies that we are implementing. And this is a place where you can share ideas, successes and learnings to help us grow and learn from each other. Please do get in contact for more information on how to embed it to your service or to be added to our virtual community space with others who are embedding digital technologies as part of their service model. Basically, spread the word. So thank you, and I will pass back across to Crystal for any questions.
That's a bit of a whiz tour into our world of digital health and a tool that is available for all of you to use. Are there any questions from the group? No news is usually good news. Are there any, has anyone used this themselves, or is this the first time that everyone's seeing this today? Thanks, Michael.
We've got time on the session. Perhaps you want to bring up the app library. It's always, I know, dangerous doing anything live, but people might want to see the app library, and we could filter down and bring up some apps and show people how it actually works.
Perfect.
Give me one moment. Okay.
If people weren't monitoring the chat channel, I posted a link to the our Dorset Orca library as well, so you can find a link there.
Thanks, Brian.
No worries, Jane. We understand that.
Okay.
Go ahead, Carly.
Should I do a little run through?
Yeah.
So this is the Dorset app library. When you will find, if you've popped in the URL, this is what you will see. We've got two different ways to search. You've got the search bar, or you've got our carousel at the bottom here. Now, the carousel has been put together by Dorset, so it is specifically the type of things that people in Dorset are searching, and we have the ability to change that so that it will be completely up to date and relevant. If you're looking to search for something, you can just pop in a keyword. So it's a bit like Google. If, for example, you know that you're having difficulties with your breathing, you pop in breathing and it brings up not only breathing, but also any associated illnesses that you may have. So it could be asthma, COPD. So you can click on there and it will sort of guide you. You then have your filters that I talked about earlier. So these are really, really important to make sure that you are getting the right types of apps. One of the key ones is definitely the platform. So you've got the option for iOS or Apple, Android, which is often the Galaxy or Samsung phones, or the web apps. Now, there's not very many of the web apps out there at the moment, but they are increasing. So for people that are using laptops or PCs, this is really, really useful. So for now, I'm going to filter down to iOS. You can filter the cost, so entirely free, in-app purchases or paid. You've got the country of origin. The designed for is really useful as well, because you can look at who your app would be aimed at. You've got functions and features. So if you're looking for something that would just be a signposting service, you can filter it down there. And then you've also got your categories. So this goes into a lot more around illnesses or conditions that you might be searching for. Say, for example, if you can't find the words. So you can see when I put the filters in, they automatically apply here. And you can scroll down and have a look. The highest rated apps are at the top, and then it just goes down as the scores decrease. Now, within Dorset, we have requested to keep app scores on there, so you will see as they drop below 65%, they start to go amber, and as it goes further down, you will see the red apps that are below 45. Now, the reason that we've done this is just to be really transparent, because often we are asked to assess apps that have already been assessed and may have gotten a poor score. So it just enables you to have a quick look and see if an app that you are already using or have been recommended, what sort of score that received, whether it passed or not. So these are your at a glance app cards, so they give you some brief information. So I'm going to go for the highest rated because it's entirely free as well. And you can see there's a bit more information here. You've got the score, you've got the levels that we talked about. You've also got how it's scored against the 3 areas that I told you about. And below that, exactly what it did and didn't pass in relation to those areas. You've got the functions and features just below that. And then at the bottom, a gallery to help you to understand exactly what it would look like if you were to download the app. You've got a download app at the bottom and a download app button at the top. And as a member user, so this, I'm accessing it as a member of the public at the moment, you've got different platforms to recommend on. Now, if you were logged into the pro user, you would have the favorite and app. So what I'm going to do is just sign into the pro user account. I see there is a question. So Crystal, would you like to address the question while I get signed in?
Yeah, sure. So Rob's popped into the chat bar, how do you factor in the inclusion of hard to reach potential users? So an app may be perfectly fit for a non-digital native who may have a device capable of accessing apps but are not tech savvy enough or not well informed enough to get the benefit from this great service. So yes, we are fully aware that this isn't going to be, it's not going to be right for everybody. And we do have a working relationship with Penny Siddle and her team, which are the Routes to Inclusion team that are hosted by our super fast broadband team in Dorset Council. And I think that we've got one of the champions or one of the members on the call today. So I think that last time I spoke to Penny, there was over 50 volunteers in Dorset that are helping with digital literacy skills. And we're certainly working with the digital board on strengthening the links with those champions and also making sure that there is a representative for each of our primary care networks. We are also in part of the deployment, so part of the technologies that we are using from this platform, specifically around diabetes, COPD, cardiovascular disease, both for the condition management, but also diagnostic tools in those condition areas. We're actually starting to factor in the digital literacy of each of our patients so that we're coding and trying to gain some intelligence and insight around where our population sits. And then looking at how do we actually fill the gap so that we're not increasing health inequalities. It definitely isn't perfect, but we do have all of the right ingredients and hopefully that's still moving in the right direction. But definitely COVID has made sure that it's highlighted some of the problems around those areas that were gaining traction beforehand. Does that answer your bit of a woolly eye? Thank you. Carly, back to you.
Okay, so I've now logged into my Orca dashboard. So this is what I see when I just click on my Orca in the top right hand side here. So I'm on my favourites at the moment. So one of my top tips when you get a pro license account would be to go on and set your favourites. Inevitably, you will always find there are apps that you go to time and time again. So it's great to be able to quickly and easily access and recommend them. So you can see some of my favourites here. When I added them, I've got the ability to recommend them again, remove them, or just view them if I'd like to refresh my memory on what it is they actually do. We've got recommendations received. So again, another one of my top tips is to send recommendations to your colleagues so you really do understand how the system works. But it also builds up your recommendations because there'll be apps that other people use that you hadn't thought of. So it's really great to always share that information. You've then got the recommendations sent. And the great thing with this one is you can see this column here, although there we go. Someone has downloaded an app that I've recommended. So you can see the phone number, the email address that we've sent it to, the date it was recommended, and the date it was downloaded. Again, you've got the ability to favourite it from this page. If, say, you find it on a search and forget to recommend it, forget to favourite it, you've got it just there, or you can just recommend it again. And the downloads is the app that you have downloaded yourself. So if you send recommendations to yourself and download them, they'll show here. So I also talked about the About section. So this is just all of the information, and you've got there's a quick video there that shows you the ORCA review process, and lots more information as to how it all is completed. So I think that's a pretty quick whistle-stop tour there of the site. Anything I missed?
No, unless I'm just wondering if you want to make a recommendation via text, and we'll see if it. I know you're not supposed to do these things live, are you really? But let's see. Do you want to use my number, Carly? And we can show you kind of how quickly these things come through. I'll see if I can take my silent.
So first of all, Crystal, I need to understand what type of platform you use. Are you an Apple or are you an Android user?
Android.
Okay. I don't want to be sending you the wrong app. So it really is as simple as you click recommend app. You know, when you get it through.
Just come through. You have a new healthcare app recommendation. Click the link below to see it, and then it gives me the hyperlink. So that's how quickly it comes through. We do currently have around about 70 or 80 pro license account holders. Some of our top recommenders are utilising this for up to 80 recommendations a month. Live Well Dorset are absolutely speeding through this. It's embedded into all of their processes. We've run support over 20 training sessions since this went live, probably even more than that. We've had around about 100 or so, 130 or so join our virtual community of practice. And from the technologies that we found using this platform, we are currently running 6 digital health deployments, 2 of them in diagnostic spaces, but also the others in long-term condition management. So all of them have very different value propositions. All of them have their own challenges. But what's great about this is that it's used for the workforce, but it's also used for the public. So we're seeing an increasing amount of public traffic coming through to this, which is really helpful. Just Carly, I can't remember, did you touch on the COVID-19 badge that came up on some of these?
So you can have a look at COVID-19 support apps, and they will have this blue COVID-19 badge on them. And this is just that they have been assessed against specific criteria to support with the pandemic. So if you see that badge on there, you can have a look at a little bit more information. So the benefits, how it would benefit you in relation to COVID-19, how it's implemented, any case studies or references that they have, and the pricing available as well. So it just enables you to look for those apps that are a little bit more specific to the pandemic needs.
And on top of all of that, some of you may be questioning, or we've had questions raised before, of why we've kept paid apps in the app library. And we've done that deliberately because it was an integrated care system and local authorities coming together, and we were fully aware of personal health budgets. So we wanted to make sure that we were still giving patients or people the choice, regardless of whether it was free or whether it had in-app purchases. So those are the reasons why you find both of those in there. Brian, you've been with us the whole time since we built the business case for this. I'm just wondering, are there any kind of, have we missed anything, or because you've been responsible for helping get this embedded within your area, haven't you?
Nothing that I can think of you've missed, apart from the fact you might need to check your phone number. No, great presentation, got all the information in there, and yeah, I just think it's a great resource, not only for for our professionals, but also for people that can just browse. It's obviously linked off our new social care site and from the Dorset libraries as well. So great resource for people to just hop on themselves and pick up some of the apps. And yeah, there's some fabulous apps on there for managing conditions. So yeah, I think you've covered pretty much everything.
Thank you. We've also just, if there are ones that aren't in there, so if you look into the app library and you see that there's a technology that you're aware of that isn't in there, we can request for that to be evaluated. They are quite speedy. We've had a couple around veteran support recently, which is a growing area for the system. So we can definitely do that. You just need to get into Dorset Digital.ccg.nhs.uk. That's the email address, which is in the slide deck that will be sent round to all of you. And certainly kind of make sure that you are, if you can, linking this into your service websites, because obviously the more that we can raise the profile within the population, hopefully the quicker this will start to be embedded and used around horizon scanning. Certainly we do have quite a lot of teams that spend a lot of time, especially our clinical teams, looking to digital health techs that they can recommend to their patients. But of course, clinical assurance is just one part of the puzzle at the moment. We definitely need to take a harder stance on the information governance and data protection that comes with these technologies.
Yeah, they are very responsive when it comes to trawling through all of the app stores, but they do have to give the providers, once they've done the review, 2 weeks to respond to that review. So so there is a little delay, but they are very responsive.
Stephen has just popped a question in the chat. It's a really good one. What metrics are you collecting to measure the success of this approach? So we're absolutely looking at the analytics that are put up every month in our community of practice around how often the searches are being made, how many visits, how many sessions are there. So that's multiple pages being looked at any one time. But starting to build an intelligence around how many are being recommended as opposed to how many are being downloaded. So that prescription versus activation, which is at the moment consistently above 50%. So those that are being recommended are definitely being acted upon. Bearing in mind that an awful lot of these, this is just the tip of the iceberg, this is really designed also to keep people out of a medical model. So it's there for building mental health resilience in children, and we have the education leads looking at how they might integrate that or how they can use this tool as part of the work that they do with their pastoral care teams and supporting students. So we appreciate that we're never really going to have the full picture of how this works, but it's definitely the foundation building block for everything that we need. So we're looking at individual outputs to this project, but also then how it sets the tone for the things that come after it. Does that answer the question? I can certainly send you more of the evaluation and how we're looking at it if you want. Can I link it to any individual health outcomes? I can for the we can for the deployments that we've done so far. So one of the technologies that we found using the platform is a company called Healthy.io. Healthy.io do urinary analysis from home, and the technology that they have, one of the modules that they have for that is something called ACR. So it looks at the protein levels in the urine. Patients can do their urine test from home. It's sent to their home. They are onboarded virtually by a team. I think the eldest patient that we had onboarded was in her late 80s. And they can do their urine analysis from home, they scan the results and it drops directly into their patient record. And the whole purpose of that is to pick up chronic kidney disease and to make sure that we are helping the patient and getting them on the correct medicines at the correct stage. So chronic kidney disease is a degenerative disease. It happens in 5 stages, and it's known statistically that patients that go undetected with that, diabetes patients in particular that go undetected, can usually hit a stage 3 that ends up in a hospital admission. So they usually have disconnected from the annual review, and that annual review is the one where you pick up the protein in the urine by doing the urine test. But if they're not attending their GP surgeries, that doesn't happen, or for some reason it's not included. And so we've picked up abnormal results for I think 16 patients, or maybe just under 16 patients so far in the pilot that we've done. But again, scanned through this platform, so it's had the correct sign off, and then it's put us in touch with the correct team, and then we've been able to link it to health outcomes. So it's very much a layered modular approach. Does that help answer that question for you, Stephen? I can certainly send you a little bit more information if you wanted to know about that particular project. And then we've had others around long-term condition management. So that's currently being powered by a company called Myam Health for diabetes, COPD, asthma and cardiovascular disease. And we've been able to link that back to health outcomes as well, but it's certainly challenging our commissioning structure. So yes, but foundation level was finding it via this platform. Any other questions so far?
Okay, lovely. Great presentation. Thanks, Carly. Thanks, Crystal.
Thank you very much.
And just posting our thanks into the comments bar. Hopefully you've booked into everyone's booked into other sessions at the festival. Please do keep the conversation going and using the hashtag Futurefest. Great session. Thank you again. Thanks for attending, and thanks to Carly and Crystal for presenting. Great session.
Thank you very much.
Thank you.